From my experience speaking to the chief of an emergency department and president of a large net of physicians, I have found that the cough that we associate with the coronavirus is not nearly the worst part. COVID-19 has been found to be very dynamic and pathogenic to a small portion of society that exhibits severe illness. At the beginning, COVID-19 resembled a flu-like virus with flu-like symptoms. It is a single-stranded RNA genome, and it attacks the respiratory system. This is what the virus looks like. Initially, it appeared that the main cause of death stemming from the coronavirus was multifocal pneumonia, which had a very distinct presentation. Patients presented with shortness of breath and hypoxia. This is what a healthy lung should look like, but when you have pneumonia, it fills with fluid, making it very hard to breathe. There have also been findings of acute kidney injury with tubular necrosis, which can lead to kidney failure, and it can be caused by severe body-wide infections such as the coronavirus. However, as time went on, physicians began to find that the leading cause of death in their patients was not hypoxia, nor was it acute kidney injury. It was COVID-19 associated coagulopathy, or CAC. It is believed that this coagulation is due to an inflammatory response to the virus. High D-dimer levels are what indicates to the physicians that there is an inflammatory response with high clotting levels. This in turn also points to the fact that higher D-dimer levels are associated with a higher mortality rate due to more severe clotting. Many patients presenting to emergency rooms and subsequently admitted into the ICU based on pneumonia from COVID-19 were found to have DVTs, deep vein thrombosis, or deep vein blood clots, which led to pulmonary embolism, which is a clot in the arteries of the lungs, which is a profound cause of death. This is an example of a blood clot that would cause this. At a hospital system in Detroit, Michigan, physicians found that the fatal clotting rates are much higher in the African American community, which begs the question, is there a pattern we should be looking for, or a biological characteristics that we should look for that could be the cause of the higher clotting rate in this subgroup? For example, African Americans are up to 60% more likely than Caucasians to suffer from DVTs, which could explain the high mortality rate if somehow the coronavirus is creating an upset in the condition of its victims. After some experience with this new aspect of the virus, doctors found that treating patients with severe illness from COVID-19 with anticoagulation therapy and medication has been very helpful and promising in reducing mortality rates. Clotting disorders are extremely dangerous and carry the risk of death, but when coupled with the other symptoms of the coronavirus, such as pneumonia and attack on the respiratory system, its danger increases exponentially. Now that we know more of what the coronavirus is capable of, we can be better prepared to treat it and continue to expand our medical knowledge of this pandemic-causing virus.